Greg Stanley. I'm the owner of Whitehall Management, located here in Phoenix, Arizona. Every so often, Whitehall introduces enough products and new concepts that we have to have an update to answer the questions that these programs create. A couple questions I want to cover today. There's a lot of talk about Whitehall's new home office school. Major corporations will hold a home office school typically after an employee's been working at least 1 year. They're brought back to the home office and really taught the doctrines and principles of that particular company. We here at Whitehall have introduced a home office school about 6 months ago, and it's really revolutionizing how staff are ultimately trained. And the second question we're going to talk about that comes in so often is, do you actually come out and visit offices? Let's start with home office school. When we introduced our first home office school, staff gathered from our consulting group here in Phoenix for presentations. We focused on what we call points of persuasion, areas in a practice where staff have to convince a patient to do something that they might not otherwise want to do. Pay their bill, show up on time, buy comprehensive care, etc. So we outlined every difficult point in practice, came up with the best scripts that we've created and that we've gathered from traveling around the country now, and introduced them in our home office school. The twist, or the thing that was unusual that really surprised all of us, was how effective it became once we introduced true testing of the staff. In other words, there are 3 major written tests given at home office school, one after each half-day session. 25 points possible. The staff's scores range from 2 out of 25 all the way up to a perfect score. And it proved to be a defining moment in Whitehall. Staff went home for the first time really knowing how to present dentistry, how to treat staff, how to solve patient problems. And it was all about the testing. The testing was hardcore, meaning that we didn't really telegraph the punches. We didn't give away the answers. We taught them, we told them that this is a test question, but then we really held them to the standard. Some staff were a little slow catching on that we really meant business. And there was some grumbling and foot dragging, but by the end of the first session, staff knew that we were serious. By the end of the second day, staff went home knowing more about practice management and persuading patients than they had ever imagined that they could learn, especially in a single weekend, much less, over a few years. And we also do role playing at this meeting. Staff get up and we evaluate how well they present dentistry. We evaluate how well they use our own principles, and we even let them use their own scripts if they think that that's better, and then we evaluate that. Without fail, we found them, even the best of them, lacking. It made me realize that the staff you have, the ones that appear effective to you, typically are only effective or only appear effective because they're with an easier class of patients, meaning patients that have been strong referrals. Maybe you're a family member of an existing patient. But when you really have to feed associate doctors, where you have to bring patients in through marketing and coupons, having staff able to bring people along what we call the patient development path is crucial. So that's the first point. We have a home office school now, and yes, it is changing the face of staff training. You see, what you saw before, what your staff had experienced previously, is what we call teaching. In other words, someone taught them or presented materials to them, but they weren't learning it. There's a difference between teaching and training, and that's the essence of the home office school. The second question I wanted to cover to update you on is, yes, we do actually go out to offices. Wes Warren, the CEO here at Whitehall, and myself go out occasionally and do visit offices. In the next 6 months, we'll have 4 dates available for those of you who are interested in actually having us come out to an office. What do we do when we're there? Well, of course, the first thing is we interview staff and observe, evaluate your statistics, and come up with what we believe to be your primary needs. Then we will design and present a training. Now, that's not teaching, that's not a seminar, it's a training for your existing staff. And yes, it will include testing. So if you don't think you can get your staff to sit still while they're trained and tested, this probably isn't the program that you're interested in. We have 4 dates every 6 months that we do this, so please don't wait around. You want to get on the list for that. Call Jeff here at Whitehall if you're interested in that. While we're there, in addition to training and testing, we'll leave you with a growth action plan so that you know step by step what to do when we leave. So that's the answer to the two big questions of the day. What's the home office school and how is it different? Now you know the answer to that. And number two, do we actually go to offices? Absolutely. And now you know what happens when we're there.